Welcome back to the Alabama Department of Public Health Customer Service Initiative. This is the final session in our series of 7, and this week we're going to be talking about being the best. We're going to get into several specific scenarios where we want you to be able to actually think up answers that would be appropriate to the bureau or county in which you work. My name is Charlene Smith. I'm glad to be with you today as we end this series on Customer Service Initiative. The question I want to ask you, if the Alabama Department of Public Health was a private sector company, would it stay in business? Would it stay in business like a restaurant? Like a store, grocery store? A department store, a hardware store? Could we possibly, with the type of customer service we provide, could it be something that would stay in business? I have another question for you also. If the Department of Public Health was a private sector company, this one is tough, but would you still be employed? Would a private sector CEO still have you employed? Now, our first reaction is always, well, of course, I'm great at my performance. But see, technical performance isn't enough. Now, it's a lot. And it probably even counts a little bit more than your customer service interpersonal skills. But the idea is this, is that they're pretty equal. In fact, Bill Gates once said, give me someone that has interpersonal skills, that has a degree in the field I need, and I can make them good at the content area of their job. So, I mean, CEOs like Bill Gates says immediately, I'd rather have someone with that interpersonal skills, customer service skills, the things that actually keep people coming back. So, would it stay in business, and would you still be employed? See, it's all about, as we said on day 1, it's all about attitude and action. Attitude. You know something, whenever I talk to people as I consult throughout the United States through private and public sector organizations, one of the things that always comes up is a person's attitude. See, an attitude you can't see. Now, why am I pausing? Because I waited for the majority of you listening to this to say, oh, yes, I can see an attitude. But in reality, what you see is their behavior, their facial expression, their gestures, which we've actually already covered, and that's believability of our communication. The verbal, the nonverbal, and the vocalics come together where we make a diagnosis, if you will, if we believe what a person is saying. So we see their behavior, their words, their techniques, but we can't see their attitude. And y'all, here is, I want to say one of the most important things. Attitude plus your interpersonal skills is what makes someone great, in fact, excellent in customer service. And then it's about your action. You got to have the actions with it. If I sit and smile at you all day and I'm happy to be here, but I have no actions to go with it, then how in the world am I serving a customer? So it is all about attitude and action. See, your smile is your logo, your personality is your business card, and how you leave customers feeling after an experience with you becomes your trademark. Now, I want to say right now, most of us are thinking of our external customers, the public. But I want to also apply this to internal customers, your coworkers, your supervisors, your employees, those in other bureaus, those out in the county. Your smile is your logo. How'd you come in this morning? Smiling? Or did you come in carrying on from whatever road rage that happened, or you spilt your cereal this morning and you're still frustrated or mad about it? I mean, your smile is your logo. Your personality or your temperament, who you are inside, is your business card. because it leaves an impression, just as if I took a business card from you and kept it in my pocket looking at it. It gives that type of impression. And then how you leave your coworkers, your supervisors, your employees, other public health employees, how you leave them feeling after they've had an experience with you becomes your trademark. In other words, it stays with you for a long time. See, service excellence is your job. We talked about touch points. We talked about the tangible and intangible points of contact. And why am I going back to this? Not because I want to beat a dead horse. I don't know, I've never really liked that phrase. But beat a dead horse because the idea is touch points are so important. I almost want that, just by osmosis put into your brain and body, because a touch point is so important because it means we have made contact. We've made contact. But what is that touch point going to be like? Is it magic or is it tragic? The tangible touch point is any time your face meets with a customer or a patient's face, or when their eyes meet any media that you've put out there. It could be a video, it could be a commercial, it actually could be documents such as certain programs or schedules or hours opening or directions, your website, anything where they see at that contact something that belongs to public health, including you as an employee. Now, the intangible touch points were anytime the Department of Public Health crosses the customer's or even a potential customer's mind. Anytime they think, oh, I need to run down there. Oh, I've got to make an appointment. Oh, here they come to inspect our restaurant. Here they come to inspect the nursing home or the assisted living. Y'all, the idea with this is when they even think of anything associated with the Department of Public Health, what is that touch point? Tragic or magic? Now, a couple of you are going to be saying, especially those that are what I'm terming as inspectors or regulators, you go in, you highlight for people what they're not doing, I'll just say not doing well, what they need to improve. And the first thing that's always said is, those are not customers. And you're right. The public, the families, the people eating in the restaurant, or the person that is in the nursing home, those are your customers. But here's the thing. See, you've got a partner in that facility or that restaurant. Question is, if your attitude and your actions are friendly, you use good interpersonal skills with that particular facility, doesn't it make your job easier? Don't you find them even more responsive to try and correct anything? I mean, yes, y'all, I get it. They're going to dread you coming. Heck, people dread me coming sometimes. And I don't even grade them or correct them on anything. But the point is, our attitude and action can make difference. And that's what touch points are about. So when they think of you coming, what are the thoughts? See, we think about our customers each day. However, do we think like a customer each day? Not about them, like them. This also is a repeat because I want you to try and really get this in your mind, not just as you listen to this presentation, but through the years to come. Not just about them, but what it means to be them, to be like them. Be them. I've got to stop and I've got to think. And we really should be reflecting every day on what our customers think about us, the experience they have with us, if they're a potential, what are they thinking? If somebody's on their way to your office to get a birth certificate or a death certificate, I mean, are they dreading it? These are the things we're going to cover in this particular section or session of information. What is it like to actually be them? So we ask ourselves, what does this even mean? It's important for us to look through to the service that public health department gives through their eyes, or in this case, their glasses. When is a customer satisfied anyway? You know, I've thought a lot about that as I've prepared these sessions. When is a customer really satisfied? And if we look at your performance appraisal, when have you met standards on your evaluation when it comes to customer service? Now, I don't mean go back and look and see if you made a 2 or a 3 or a 0 or a 4. But what I mean by that is if you do make a 2 on an R&R, what is that standard? It should be complete customer satisfaction in what you do. I understand it gets gray out there. A customer says you did one thing, you don't think you did that. A supervisor is mediating perhaps in a more tragic event. And what we end up doing is looking at, okay, he said, she said. You're never going to get to the truth about that. Both parties believe, in most cases, that they did what was right. I'm not talking about those cases. I'm actually referring to your every day, every minute, every 5 minutes, every hour that you are providing customer service. When you have a touch point with a customer or patient. If you are in the communications, what I'm going to call the marketing side of public health, everything that you create, are you looking at it as a touch point for a potential customer or patient? So what is great customer service anyway? What is a great experience? Well, I'm going to take you even further because with 6 sessions, we've been talking about customer satisfaction. You know, I don't like that. You know, when I go do a seminar, when I go do consulting, when I work with a group on facilitating a problem or a decision for their organization, one of the things that I think about is I don't want them just satisfied. I mean, in today's world, that's kind of like not a good thing. So what we need to look for is what could be even better than customer satisfaction. And you know what I think it is? I think it's customer devotion. They are devoted to you. Now, before we move on, I do want to stop and say, I understand some of you watching this are going, Charlene, you don't know what you're talking about because we're not in a field. We're not in a service arena. Any of our bureaus, any of our county facilities, we're not in the type of service where people are going to be devoted. You must be talking about a restaurant. You must be talking about the type stores like Home Depot and Lowe's or Walmart or Sam's or Costco or Dillard's or whatever else, other stores that are out there. Actually, I'm not. I really mean this. How can you have devoted customers? The second thought that probably crossed a couple of your minds are those that do go out and regulate. You know, the thing about that is, how are you going to get them to be devoted to you? Well, I'm just going to be honest. You're probably never going to get them to be devoted to your inspections. But you know what you can do? You can have them devoted to you. They would rather see you coming than anybody else. And let me give you an example of that within my job. There are a couple of organizations that I've been training for years, or someone within my organization has been training them for years. And here's what I know by devotion. If someone from my training organization shows up, they're satisfied. But you know what I found out that happens occasionally? And goodness knows I've been doing this long enough that I hope I'm pretty good at it. But I walk in, let's say in Mobile or in Atlanta, and they'll say, oh, we're so glad you're teaching today. And when I say, well, you didn't like the person that was here last month or last week, they'll go, oh, no, they were okay, but we wanted you. See, you can actually do that in many of the cases. I know you're not out there selling. This is not retail. The idea with this is, though, can you get them devoted to you because you are the Department of Public Health? So let's think customer devotion. What we're going to be looking at is a square divided into 4 quadrants. What I want you to do is, this stays up on the screen, I want you to look at the yellow or the gold arrow that goes up and down. See, at the top you see high expectations. What does that mean? The customer walks in and they have high expectations. They've either heard great things, they've been in situations where they've dealt with you before, and their expectations are high. Now look at the bottom. Low expectations. Either they have heard it's not so great, either they've experienced the public health department, say in another state, and they don't think it's that great, or maybe they just think, well, anytime I have to deal with government, it can't be that great. But in other words, they come in with low expectations. Now look at the horizontal line, a white arrow going in both directions. That's the continuum for them. On the right, as you look at it, a great experience. You give them devoted customer service, excellent customer service. You put into effect everything, all the objectives, all the goals of the 7 sessions that we've been talking about. So when they come in, they have a great experience. Now on the other side, which would be the left side as you're looking at the screen, is poor experience. They come in and, buddy, they don't get anywhere near great experience. There are a series of tragic touch points that occur. And you give them a poor experience. Just want to mention one thing with that. How many of us, when we get absolutely terrible service, continue to go back to that shop, that store, that whatever, restaurant, eatery? That's my point here. Very poor experience. Now, I'm not saying that I've tried to run every comment you may think during this presentation, but I'm going to be honest, I've thought about a lot of them. So the first thing I think with poor experience, you're going to say, well, that's because of what we have to do in my bureau, in my unit, in my clinic. And the answer to that is customer service is attitude and actions, apart from what your task or your responsibility is. How do you treat people when it comes to service? And of course, with both arrows, the gold and the white, it is a continuum which divides this into 4 quadrants. Let's look at one of the first ones. They come in, a customer comes in, and with high expectations, and you blow it out, you give them a great experience. They become devoted. See, customers either start with high expectations if they've heard great things about you, or expectations will rise over time as you continue to reinforce with good performance. But you know, devotion is good. But you know something? We want to take it not just at the bottom of the quadrant, we want to take it all the way to the top of the quadrant. So we've got to ask ourselves, if they come in with the highest expectations, do we give them the greatest experience? Is it that touch point that is magic each time? In our first session together, we said reliability or dependability was very important, and assurance was very important, that customers receive that from us. Well, here's the thing about that. Consistency is important in customer service because they need to receive magic every time they cross your doors. That's what takes it to a higher level. So what we're going to do now and 3 other times, I'm going to ask you to pause this recording for about 60 seconds. And I want you to brainstorm, what do you have to do in your area of public health, in your R&Rs, if you will, your side of the technicality, whether you're in a lab, whether you're behind a desk all the time, whether you're with patients out in the county, whatever it is, I want you to brainstorm 2 or 3, 5 would be great, but I'll settle for 2 or 3 ways, methods, techniques, things you can do to take a customer or a patient from just being devoted to the highest level. So what I want you to do is tell us or discuss, think, if you're with a group, discuss, how can you take them to the highest level of devotion? I'm going to give you 1 or 2 examples to get you rolling. One thing would be an immediate greeting. When they walk in the office, the door, the facility, are they immediately greeted? Or do they have to walk to a counter or up to a desk or open a door before anybody says anything to them? Now, if we do that, we're probably going to take them to a higher level of devotion. Another one, I know when you go in a restaurant, someone who continually fills your water, your tea, your Coke, whatever it is you're drinking, so that the minute it gets low, it's filled up again just like that. That's something that you start to realize with certain restaurants. There's a restaurant, kind of more of a deli, that I go to frequently to meet clients. And one of the things that I've noted is my well never gets dry, or my glass never gets dry. By the time it's about low, they come back. They check several times about napkins. This is just a deli, not a fine dining restaurant. See, the one thing I know that has me going back for years, they're fast, they're very efficient, very friendly. I've never met one unfriendly waiter or waitress, server. And the idea is, I'm devoted now. When I have a training session that needs food, who do I go to? I go to that deli, because that's a group that I know I'll get great service from. And in the end, how does it help them? I probably put them on social media, comments about them. Obviously, they get the money from the visits that I have, but it's not just me. A lot of people feel that way. They're great. They're magic with the touch points. So let's pause right now and you think of a couple of examples. Thank you for taking that time, for thinking a little bit about what some examples are. If I was with you, I would actually ask for some of you to volunteer your examples over a period of time. But y'all, it's not, please realize before we move on, it's not just good enough to have great customer service, meet their high expectations. We need to get them devoted to us. It's going to come back to you on social media through the reviews. It's going to also be shown by how many times the people come back to you or depend on your knowledge or ask for your services or come in friendly because they're not dreading coming to a government agency. Can the Department of Public Health be the absolute best government agency in Alabama? Now, there are other alternatives. See, if you look at the quadrant, it's the lower right-hand quadrant. It's called delighted. See, if somebody comes in with low expectations and you give them a fantastic, a great experience, in other words, you're working your magic again. Great experience. But they came in not expecting too much. They are actually surprised at your service, the level of service. The idea that I had no idea they were going to be this good, this great, this friendly, this dependable, this reliable. Assure us. I didn't know they would dress this great, talk this great, be animated, have the office etiquette they need, write the proper emails, take time to follow up. And I could keep going with everything we've talked about over the other 6 sessions. But they're surprised, so they are delighted. And delighted is wonderful. But you know what? We want them to expect more of us at the Department of Public Health. So the question is, what will it take to get the delighted folks up to becoming devoted customers? It's pretty easy to move people up, but you got to be consistent in your service, or they rely on what they've previously thought or heard. See, if I was coming into public health, and I came once, and I was delighted. I had a great experience with y'all, customer service experience. But then the next time I came, you were back to not so good experience. What's going to happen? I easily fall back into my low expectation mode. So, we're going to pause again for 60 seconds. And I want you to think of 2 or 3, possibly 5 tangible things that you can do to take someone from delighted up to devoted. In other words, what can you do to make me a fan of the Department of Public Health? You can pause now. Very good. Thank you for either discussing it or thinking of several things that you can do to take it to a higher level, to make it magic. But we haven't used all of our quadrants yet, so let's move ahead. The more you engage with customers over a period of time, the clearer things become. Well, what things? What they want, what they expect, expectations. And the easier it is to determine in across from them what you should be doing. See, I've got several clients that I've been with literally, gosh, I could even say 20 years. I mean, you know, before I worked at State Personnel, I knew them then. And then they have kept requesting my services when I left State Personnel and went to 2 different universities. And I've been working with them, some of them 20 years I've known them. Here's the thing. The more I know them, the easier it is for me to know what they want from me, to know what they expect from me, what they don't expect from me. That's what I'm talking about here. So, just a little point in trying to get people from delighted to devoted is to think about how well do you know your customers. Some of you are saying, Charlene, I don't think you get this. I may only see somebody one time. I get that. I may only see somebody one time. And that means that one touch point, it has got to be excellent. But sometimes we see people more than once in the various functions of the Department of Public Health. And if we do, we want to try and move them up to devoted. So let's move to the top quadrant on the left side. It's called disappointed. I guess I shouldn't sound so enthusiastic on this point, but it is called disappointed. Now let's look at the quadrant it falls into. They have high expectations walking in your door, calling you on the phone, waiting to receive your email, or your surprise visit because you're going there to actually survey in some way what they're doing. They have high expectations. Then they get a poor experience. Let me give you another example right out of your department. One would be during a tragic event such as Hurricane Katrina or any of the flooding that has gone on in our state. In comes the Department of Public Health to help out. You can't tell me that the citizens don't expect a lot from y'all. I mean, they've been devastated. They have high expectations. The question is, what do you deliver? Do you deliver a poor experience? That's just another phase that came to mind when I was thinking of the people that go out to help during times of disaster. What type of experience are we giving people at their lowest moment? We don't want anyone that comes to the Department of Public Health to walk away disappointed. You know, I don't think I have to tell you, because I've mentioned it several times, they're going to immediately go tell at least 10 to 15 people about how horrible their experience was. See, they're going to meet somebody for lunch or dinner and go, so what were you doing today? Oh, my goodness, I had to go to the public health department. Oh, it was horrible. I'm so disappointed with them. Or they're going to get home and they're going to open up Facebook or one of the probably hundreds of different things we can use for social media now. And what they're going to do is, I just don't understand why government can't be better. I'm not satisfied with good enough for government work. Went to the public health department to get or to do XYZ. It was horrible. Y'all know now tons of people read those. Tons of people read those. What does it do? I want you to think right now of their expectations when they have to come to your office. They're going to walk in with low expectations because they heard through whatever means about how horrible it's going to be, how y'all don't have good customer service, how it's slow, undependable, unreliable, inconsistent, non-responsive, all the things we covered in session 1, how there is no etiquette, whether it's in the office or email or on the phone. And if I walk in with low expectations, you're going to have a much harder time pulling me up to where I have high expectations. Let's start everybody out with a magic, not a tragic touch point. So if we look at disappointment, the question is, how can we get them back to devoted? That's going to be one difficult road from a disappointed state back to, or for the first time, to a devoted state. So we're going to pause here for about 60 seconds. And what I'd like you to do, as with the other two, I'd like you to kind of brainstorm 2 or 3, possibly 5 things. And when I mean by things, I mean actual specific behaviors that you can engage in to bring someone who is disappointed back into customer service fan of ours or someone who is devoted. Let's pause this recording. Welcome back. I think it's important to look at a couple of these. Again, since I'm on a recording, we don't have your input, but I want to give you a couple of examples. If I, for whatever reason, came in with high expectations, in fact, let's say, for instance, I do need to pick up a birth certificate. And I've done all this training for y'all, and I think public health is great. Everybody I know, and I mean this, I love the people that I know on a more personal level from and have worked with. I think y'all are great. But let's say that I have to get a birth certificate, and I choose not to do it online. What I'm going to do is I'm going to come in, and I'm going to meet face-to-face with somebody. I have high expectations, and guess what I get? Hold on just a minute, I'm on the phone. So I sit there and I listen to their telephone conversation. And then maybe I'm directed to somebody who just kind of gives out a sigh, who says, what do you need? I need a birth certificate, social security number, name. I mean, no, how you doing? Anything. Just straight to business. Well, we've already looked at the fact that that is not proper interpersonal skills. What's going to happen, instead of me being sent to devoted, I'm going to an example of a poor experience. So what would be better? I have high expectations. Last time I was disappointed. This time I come in, let's say to a clinic. And instead of being disappointed again, I get not a welcome to Moe's, but I get something like, good morning, how are you doing? Please write your name here, and we'll be with you in just a moment. So I write my name, I sit down, and within minutes, at least I'm recognized, maybe given an estimate of the time. That's responsiveness. Maybe I'm assured that that doctor, that nurse, whoever it would be, will be there to help me. Y'all, that's going to move me over from disappointed to devoted. And when I leave, they give me a greeting goodbye, even if I'm sick. So the idea is we've got to examine what we can do to get over there. Now, we've got one more quadrant. It's not a happy one, I'm going to tell you right now. See, somebody walks in with low expectations, and they get, it's confirmed, they actually get poor experience. Another case scenario would be someone that is disappointed comes back again, and look at this. They actually get poor experience. What do we immediately do? Well, I don't know the individual actions that you listed that go with your R&Rs, but I'm going to give you 4 things you do immediately. It doesn't matter who you are in public health. First thing is you listen to what they need to say, maybe their complaint. And the very next thing you do is you apologize. You may not have even been the person who dealt with them, but you apologize. You are the face of Department of Public Health every time you come to a touch point with a customer or a patient. So you say, I'm so sorry you had that experience. Then you ask, what can I do to help you today or to remedy that situation? Listen, apologize, ask, and when they tell you, you act on it immediately. You go to work and do whatever it is you listed on our last little pause. Get into action. Attitude and action equals devoted. Let's take that disappointed service, though, and let's say it goes all the way down to what's called disaffected. I don't even know, that doesn't even sound like a good word. They're not devoted. They're not delighted. And even worse, they're not disappointed. These customers and patients are disaffected completely. They had low expectations. Either you have given them or they heard through the grapevine. And guess what? You reinforced it because, buddy, you gave them a poor experience. Let me talk to you a minute about that. To get a disaffected employee back to devoted is the hardest road that you can manage. It's virtually impossible, but in several situations, take away impossible. It's virtually impossible. I didn't say it was impossible. Because the poor experience, you know why it's disaffected? When you gave a poor experience, you broke the trust with the customer. You broke the trust. Let me mention that. When somebody breaks the trust with you as a customer, they don't do what they said they were going to do, and they break that trust, how do you think and feel about them? I'm going to give you an example, and to be honest, I can't remember whether or not I've mentioned this earlier. I don't think I have. But I know I went to we'll just say one of those hardware outdoor plumbing stores. I don't want to give anybody a bad name on camera. And I went in there to buy a grill. Very simple grill, that you cook on. Not the grill across your teeth, but that's beside the point. Okay, so we went to buy a grill. Okay, this is how maybe spacey I am. I pointed to the one on the floor that I wanted, and they said, well, it'll take 10 days to put it together. And I was like, what? I'm not going to take home parts because I don't put things together. And I said, can I just have the one on the floor? No, ma'am. That could be scratched, whatever else. I said, okay, 10 days, and y'all are going to have it put together. Yes, and we will call you or you call us in about 10 days because it may be ready a little bit earlier. I called and called and called. It was never ready. On the 11th day, it was ready, and I went to pick it up. I don't have a truck, so I borrowed a friend's truck to put the grill in. As it came out, it was not even the right grill. I mean, I'm talking about brand, size, the grill functions, all of that, not even the right one. So they went back and they said, maybe we just picked out the wrong one. But sure enough, my name was on that one. They'd put together the wrong product. So I said, can you get it done in 3 days? Yes, ma'am. Yes, ma'am. We'll get it done in 3 days. 3 days I go back and they bring out, and it was the right grill, but as they put it up in the trunk or the back of the bed of the truck, I noticed it's like all scratched up. It's probably the one off the floor. I don't know. But I started pointing it out. And I said, look, there's scratches here, scratches there, a little bitty dent on one of the side rollers or legs. And I said, why does it look like this? Well, I mean, it's going to get scratched up in your backyard anyway. Yeah, but if I'm going to pay hundreds of dollars for a grill, I wanted at least one day to be spotless. Is that too much to ask? So they took it off, went back, give us 3 more days. So finally, on my 4th visit, they got it right. Now, what had happened even by the first trip I made to pick something up and didn't come home with the grill? Y'all, they broke the trust. I no longer trusted them. So every time I came, I already had low expectations. So what'd they do? They just kept compounding that to where I was totally disaffected. They broke the trust. And as you see on the slide, they actually reinforced my poor experience 3 more times. They reinforced my experience that was poor and my low expectations. I mean, y'all, when people are disaffected, their heels are dug in because you know something? It means you had a touch point, 1 or more touch points, and you blew it. Several of y'all are probably mad at me right now, but I need to be honest. We blow opportunity all the time. And you know why we blow it? Most of the time, it's not because we can't do something. It's not because we can't do it or we don't know how. Most of it is based on a bad day, bad mood we're having. We talked about that the first day, first session we were in. Y'all, we cannot put ourselves over service. We cannot put self-interest over service. You know, and I may have mentioned this, but I want to bring it out a little bit more. Disney is known for their customer experience. And I can think, wouldn't it be horrible if one day Snow White, out walking among the kids and the family, decided she was going to live out her bad day. I mean, you know, she got up, she couldn't find her uniform, or, of course, they put them on at the studio, but she couldn't find what she needed. She got stuck in traffic. She was almost late. She's out of breath by the time she gets there. On top of that, the IRS called her and said they were going to audit her. I don't know what was going on. So she yanks on the Snow White outfit, and she goes out there on the little trails among Disney World or Disneyland, and she is just in a bad mood. So a kid comes up and she goes, "What do you want?" Touch point number 1. So the father says, "Well, Snow White, we'd like to take a picture of you and my daughter." So you get in the picture and you're actually turned the other way. Of course, you're smiling because you have one of those masks on, or let me say, painted on, if you will. The idea is Snow White cannot have a bad day. Because what Snow White would do is disaffect everybody she comes in contact with. And see, you're only given one chance. One chance at Disney. If it is verified that you had a bad Snow White day, you're gone. Now remember, I said verified. But the idea is this. we can't have bad days. I don't know where we actually thought, well, it's just one day, maybe 2 days a year. Y'all, and I have to think of this too, we don't have a right. We don't have the authority. We are not entitled to have bad days at work. But somewhere, I've heard it too. I've heard this too. Well, everybody has a bad day now and then. We do that to professional basketball players, professional football players. Well, it was just a bad day. I know our skill level can be down one day, but you know something that never has to be down, not one day. And that's our interpersonal skills and our office, email, and phone etiquette. That never has to shut down because it actually is a reflection of who we are inside. So what we're going to do is pause for about 60 seconds. I want you to pause the recording, take about 60 seconds, come up with 2 or 3 things, and y'all, they got to be biggies that you can do to get someone from disaffected back up to devoted. It's going to be big things. Don't think your smile or your charm is going to get somebody there because the trust has been broken and the poor experience has been reinforced. About 60 seconds, think about what you can do disaffected to devoted. You can pause now. Thank you for taking that time to actually think about some examples of what you can do. Now, I know that one is probably the toughest of all because, well, disaffected customers mean we have blown our tangible and intangible touch points. But let's move on. See, every touch point we have with a potential customer, patient, influences whether or not they'll actually become one. You know, in the county health clinics, y'all, each citizen has a choice. Do they want to go there or do they want to go elsewhere? So this particular division, area, county really does have one of those areas where potential customers come into play, potential patients. What have they heard from other people? What have they seen the one time they went there and hadn't been back in years? So, yes, every touch point with a potential customer. A commercial. Words from other people. Your marketing and promo material that they've picked up. Will they become one after they've had that touch point? And then, with our true customers, the ones who've already come, every touch point we have with an existing customer influences whether they will continue their customership with Department of Public Health. As a customer, will they continue? Very important if we're going to build momentum where we have people that have a positive light, have a positive thought, have a positive and a magic touch point with the Department of Public Health. Our customer service initiative, has been 7 sessions, but y'all, I hope it's been more than that. Because what I want us to do is really think about what type of service are we really giving? Let me ask you a question. What makes you who you are? What makes you who you are? Well, we've covered that some. Your early experiences, the culture you were born into, culture not meaning necessarily a protected class, but the culture, the environment, what you did every day. Kind of makes you who you are today, including experiences after you were a child. your education, your years at that university or community college, and then on into what you've experienced in life. That makes you who you are. But you know what else adds to that? The number of years you've been with Department of Public Health. Because, y'all, we actually, how can I say this? We actually determine our own future by what we do today. You know, I have a friend who has a friend. How's that? And this person has kind of worked themselves down into a low state, emotional state. Every time I talk to him, it's like, well, why don't you do this? It should help. Why don't you do this? I mean, for months. And the idea, when it comes down to it, they're responsible for their own behavior. Someone else can only do so much. We've given you 7 sessions of information, and I hope it's good information. Well, I know it's good information. I hope you've taken it to heart, because when you wake up every day, how you act in adulthood now makes you who you really are. Second question, how do you gain a reputation? You gain a reputation by what you do today. Whenever I'm teaching leadership to young professionals, it's real interesting, because when I'm talking about their competency or their technical field, or when I'm talking about another characteristic is their character or their personality or temperament, each time, those 3 things, each one of those, your track record is included. That's right. If we make 1 small, 2 small, 3 small, 1 big error, that can follow us through life. So we've got to make sure our track record is good, and it begins every day. Every day we have the opportunity to say, you know, I may not feel like it. In fact, I may feel horrible, but as long as I'm here, I'm going to exceed customer satisfaction. In fact, there's no more satisfaction. It's customer devotion. That's how you gain a reputation. And by the way, that's how the public, that's how your coworkers are going to know you, is based on what you do every day. I've said it before, I'm going to say it one more time. Our perception of ourselves can be vastly different from how others perceive us. But perception for them is the reality. How are you conducting yourself in attitude and action every day? Not just with customers, external, but with internal customers also. What I'm going to do is leave you with about 4 different thoughts. And the reason I chose these is because I think each one is an encouragement for us to do better than just meet standards, customer satisfaction. The first one is by Sam Parker. It says, if we want to matter and we want to be happy, if we want more freedom, more flexibility, more responsibility, or even more money, we need to give more to those we're serving, our customers. What Sam Parker is actually saying here is, if you want anything great, then we should be giving that to our customers, because they're the ones, the public, the citizens of Alabama, they're the ones in the end, when we serve them, we benefit from that. Not only through our paycheck and our reputation, which both are, I think you'll agree, are pretty good things, but through many more intangible areas, we benefit. So, as Sam Parker said, what I want to make sure we're doing is serving our customers to a level of devotion. Now, we're going to go over just a couple of points about the 7 sessions and where we're headed. Well, June 1st through September 31st, and if you're watching this, you've probably seen 7 2-hour seminars on customer service for supervisors and employees in every bureau or county. Second, I'm in the process right now of helping public health develop R&Rs to measure your performance in customer service. Now, what I mean by that, we're writing R&Rs, responsibilities, and the results for customer service. And you know what those goals or their results are going to be based on? The objectives of each one of the 7 sessions. Because if we've covered it, you and I are responsible for performing it. Then October 1st through about the end of October, I'm going to be doing a couple of very short but supervisory seminars on rating employees on those R&Rs. Because though all we probably all know the performance appraisal system, when it gets down to the specific results, we need each supervisor to know exactly what they're looking for in performance and how they can provide feedback regarding that. October 1st through December, there's going to be an execution of an extensive department-wide communication plan to continue to develop a customer-focused culture in the Department of Public Health. One of the things is there's going to be a series of short newsletters, news clips about customer service coming out. Second, there are going to be a couple of keynote, I call them keynote, but motivational, maybe 30 minutes to an hour that can reinforce some of the behaviors and hopefully give you a little momentum, motivation to carry on with the customer service initiative. Let me end with 3 more of the thoughts. George Bernard Shaw said this: progress is impossible without change. And those who can't change their minds cannot change anything. Here's what Shaw was saying to all of us. If you want to make progress, you got to change. Change has always been what brings progress. Not having a phone to having a phone. From having talking to the operator phone to having the smartphone you do today. Change all along the way. It's caused by progress. Well, see, the 7 sessions we've had in customer service in Department of Public Health, we've offered changes. But when it comes down to it, you know, it's really one thing. You've got to change your mind before anything else can change. You've got to say, you know, I'm going to wake up and I'm going to start initiating the different things I learned and the things I already knew about excellent customer service. I'm going to take every opportunity to make the touch points great experiences. Winston Churchill said this: to improve is to change. To be perfect is to change often. Churchill. If we're going to get better at what we do, as a department and as an individual, as a county among other counties, as a bureau among other bureaus, as a department among 130 to 50 state agencies, we've got to change. And if we want to be the best, perfection, we've got to even change more often. So the next 3 months, put on your seatbelt because we need to fly. And lastly, I'm going to leave you with a quote I really like, Jim Rohn, who said this: you must take personal responsibility. You cannot change the circumstances, the season, or the wind, but you can change yourself. That is something you have change of. Y'all, even to change ourselves, we have to change our thinking. We can't control the things around us. You can't decide that public health needs to do more retail type stuff so that we can look good and give away free things. Not at all. Government doesn't have that option to have sales and produce all these t-shirts and give away free tickets to this and that. But you know what we can take charge of? Not the circumstances, but who we choose to be, who we wake up to every morning when we look in the mirror. When you look in the mirror, are you seeing something or somebody who has taken the customer service initiative to heart. Y'all, thank you so much for joining me during these 7 sessions. I know, I believe, I am convinced that if you put these principles into practice, the Department of Public Health will continue to be great or will become great in the different areas. And you know something? It's up to you. Thanks so much for your time.